2023 has been filled with many memorable events and crucial projects, driving significant advances at the Ministry of Health, which mobilized partnerships and innovations to enhance developments in health service delivery. Reflecting on the year, the Director of Planning at the Ministry, Jibril Jaju, cited infrastructural developments and acquisition of vital health services equipment as some of the major achievements of his ministry during the period under review. The infrastructure, he added, includes massive advances in the refurbishment of the Edward Francis Small Teaching Hospital and the ongoing construction of the state-of-the-art hospital in Farato.
We've seen the work that is ongoing at the Edward Francis Small Teaching Hospital. Currently in country, 8 X-ray machines to be actually installed in all hospitals. That have modern technology to be able to diagnose people's problem. And there's also great work going on at the NICU, that's the Neonatal Incentive Care Unit. We have a master plan for Farato, and Farato is going to be the new focus for the Ministry of Health under the leadership of Dr. Ahmad Lamin Samati, Honorable Minister of Health. We have a master plan for Farato to actually make it the new teaching hospital.
The ministry has also completed a general birth registration exercise started in late 2022 and a community mop-up for those who missed the exercise. These initiatives came against the backdrop of the deployment of new digital technology to ease birth records and enhance health data repositories.
If you are moving on to the next pillar in terms of health information system, which is a pillar in healthcare service delivery, we have seen the digitization of the birth certificate, which is actually very unique in its sense that we want to provide every Gambian a unique number from birth to death. And we have over 1.2 million Gambians issued with new birth certificate with new, unique identifier. And apart from that, the ministry is implemented very interesting systems to be able to support in terms of operationalization. We are trying to implement now an EHR system, which will track every healthcare worker within the health sector.
Jaju also highlighted the graduation of the first ever batch of medical doctors who were fully trained in the Gambia as a huge achievement for the ministry in its resolve to build the human resource base of the health sector.
Previously, what used to happen is once our young doctors graduate, we send them to Ghana, we send them to Nigeria and other parts of the world to actually do their specialization and come back. And some will come and some will prefer staying. We've already enrolled our people to postgraduate diploma in anesthesia. Those are new areas and also nursing specialization fields that are currently happening. And we are supporting the university to also start a new program on pharmacology.
Another major activity carried out by the ministry was the stakeholder review conference organized at the end of the second quarter of 2023 to promote participation and accountability in the sector. The biggest challenge of the ministry, Jaju disclosed, was the acute kidney injury outbreak that claimed the lives of dozens of children. The outbreak, he added, has also served as a wake-up call for the ministry, leading to ongoing efforts to establish a food and drug lab at Bursubi.
The committee suspected that the AKI could be caused by drug toxicity since paracetamol toxicity was identified as a cause of AKI in some countries in the past. The World Health Organization country office helped to send patient samples and samples of drugs used by these patients to laboratories in Senegal, Ghana, France, and Switzerland. The Ministry of Health decided to ban these drugs even before receiving the confirmation from the laboratory testing.
As I speak to you now, the ministry have signed contract and there is work ongoing for the country to have a first food and drug lab in the country. We'll be doing our own tests of drug and we'll be doing our own tests on food, in the country. And that work has started in Brusubi, turntable.
Jaju acknowledged that some of the planned activities, such as the completion of major health facilities, couldn't be achieved. He, however, assured the Gambian people of the ministry's commitment to improving service delivery in the year 2024, which he said will focus on the acquisition of consumables and other vital equipment, while major facilities already constructed are expected to be inaugurated in the first quarter of 2024. Alagie Mbye, GRTS.